As critical care nurses, we know that arguably the most important organ in the human body is the heart. The heart beats approximately 100,000 times a day, 35 million times a year, 2.5 billion times in your average lifetime. Let's take a step back to a moment before even our first breath. It's a miraculous occurrence. Within the first few weeks of gestation, the heart begins to beat. A tiny yet resolute drum in the symphony of life. But the heart's significance transcends mere numbers and statistics. It's the very essence of our vitality, sitting at the core of our being. It's not just an organ, it's the seat of our emotions. It fuels our bodies, it nourishes our cells, and it sustains our minds. Without it, life as we know it would cease to exist. So understanding how it works and how to optimize its performance in the critical care setting is essential. And in doing so, we begin to understand how blood flows, how the mechanics of the heart pump it continuously throughout the body. And this is what we call hemodynamics. Now, in order to understand hemodynamics, we first start with the basic anatomy, the symphony of the cardiovascular system. Now, this orchestra is composed of the heart and a dense network of capillaries, arteries, and veins. It's a continuous fluid-filled circuit with a pump that provides continuous communication throughout the entire body by transporting oxygen, water, enzymes, buffers, minerals, vitamins, white blood cells, antibodies, and waste. And by adulthood, we're circulating about 6 liters of blood through a dense vascular network that, if stretched end to end, would cover the entire surface of the world 2 times over. Isn't that fascinating? So as a nurse, it's vital that you understand the mechanics of blood flow and its anatomic pathway within the heart as it circulates. Because if you know how it's supposed to work, then you as the clinician can better determine, based upon the patient's presenting signs and symptoms, how to diagnose and treat when it's not working. So here in the heart, we've got 4 chambers. Blood's gonna flow from the inferior and superior vena cava, and it's gonna enter into the right atrium. And then it's gonna be pumped into the right ventricle, into the left atrium, and then into the left ventricle. Separating these chambers are valves, opening and closing with each contraction every second of the day. And it's important to understand these valves, how to assess them, how to listen for things like murmurs, stenosis, regurgitation. So we have 4 valves separating our chambers. You've got the tricuspid valve, you've got the pulmonic valve, the mitral valve, and the aortic valve. And these are going to be helping blood pump forward from the right side of the heart into the lungs to the left side of the heart. Now, on the right side of the heart, where blood comes from the body, from the superior vena cava and the inferior vena cava, this is a low pressure, thin-walled system. This is where that deoxygenated blood comes from the body and it's pumped into the lungs, and that's where gas exchange occurs. CO2 goes off, oxygen comes on. And then from the lungs, this is where oxygenated blood comes to the left side of the heart. And this is a high pressure, thick-walled system. And this is where that blood is pumped, oxygenated to the rest of the body. Now, just like a symphony can't function without its conductor, the heart can't function without its conduction system. Now, these are those specialized pacemaker cells, the nodes. You've got the sinoatrial node, atrioventricular node, bundle of His, and the Purkinje fibers. As electrolytes, calcium, sodium, potassium, pass in and out of these cells, an electrical impulse is created in a delicate sequence, causing the muscle fibers within the heart to contract rhythmically and relax continuously. And we can observe their performance by looking at the electrocardiogram. Now, as nurses, we're not just learning about hemodynamics to pass an exam. We're entrusted with the responsibility of safeguarding our patient's cardiac function, the delicate balance, whether it's monitoring blood pressure, assessing cardiac output, or looking at interpreting the fluid and electrolyte status. Our proficiency in hemodynamics directly impacts our ability to provide timely and effective interventions, ultimately influencing the trajectory of our patient's recovery. So you're not just studying to pass an exam. You're studying to prepare for the day when you're the only thing standing between your patient and the grave.